Prince's autopsy report released last week finds the superstar died after accidentally overdosing on the painkiller fentanyl, a drug approximately 80 times as potent or more potent than morphine. ABC 7's Alex Redmond talked to a Suncoast pain doctor about how and when fentanyl should be prescribed. Alex.
Thanks, Haley. Prescription medications are monitored now more than ever, and a newly published study suggests the ways to possibly control opioid abuse is to pay attention to the doctors.
What is it like to live in chronic pain?
You're fine if you don't move, but the minute you move, the pain is there.
But Madeline Tiffany says she has a high pain threshold.
So it takes me a while before I say, enough, I need to get something done.
Tiffany adds she constantly hears of abuse.
I have a few friends who have, I believe they have become addicted to the painkillers with pain that doesn't go away.
Pain medicine doctor Douglas Erb treats Tiffany and other patients for a variety of ailments and says the CDC has new guidelines for administering pain medications.
These are all guidelines that really don't restrict doctors' hands. It just makes sure that doctors are prescribing and following their patients appropriately.
A study published in the journal Health Affairs finds prescription drug monitoring programs are associated with sustained reduction in opioid prescribing by physicians. In fact, more than a 30% reduction in the rate of prescribing Schedule II opioids such as morphine, oxycodone, and fentanyl.
Fentanyl is definitely a mainstay in treating chronic pain as well as cancer pain in humans, and it's also used in the veterinarian world.
Fentanyl has lots of great uses for people in pain, explains Dr. Erb, and comes in many different forms.
Usually the form that most people are familiar with is a patch that gets applied to the skin. There's also a nasal spray and a sublingual spray, and also some forms where you can dissolve it in the mouth.
When used appropriately by the direction of physicians, these medications are essential for treating pain, says Dr. Erb, and they're life-saving for lots of patients.
It's only when patients don't follow the doctor's directions or when they start abusing the medications by acquiring them illicitly on the street or from other places that they become a problem.
New voluntary CDC guidelines encourage doctors to try something besides an opioid when first treating pain. And if an opioid drug is the best choice, they need to start with the lowest possible dose.
And Alex, how do doctors know if their patients really need these strong pain medications?
One thing that Dr. Erb said is that there are tests that they can do with the patients to make sure that they're not already on all these medications. They can look at the urine test, but the main thing is to get to know the patient, to keep with that patient. It's about familiarity and just building a relationship. And of course, there is, the registry that you can find online where the pharmacist and the physician has access to see if that person, right, is a repeat, going in there for repeat medications.
That's right. All right. Thank you, Alex.